Intermittent to benefits and broad economical odds are growing consumer demand for psychological public health thoroughness, NHS bosses tell. Psychological public health leaders in England quoted the evacuation of versatile letter of credit, in special, as a key element. They as well told cash problems and job trouble near public factors, such as solitude, were addition blood pressure to an already extended framework. By the government recognized down there were challenges in reforming benefits, but told it was dealing them. A representative as well tense how psychological public health services were a core precedence for the increase in financing to the public health facility in the upcoming year. He told the additional pound creature nested by 2023 would growth the ratio of the budgeting consumable on psychological public health. We're not smug although and we aware how changing when tea occur night, he added. The way by the government is overhaul the benefits framework has brought critique. A new framework named Versatile Letter of Credit is now creature rolling of. It involves the merge of 6 various benefits for work-age human beings in one monthly average fee. The framework, at first entered in 2013, was imaginary to be up and fleeing by 2017, it is now not anticipated to be completely operative before 2023. Yet, it has been criticized for fleeing above budgeting, challenging intermittent to human beings as payments or, in several cases, manufacturing sensitive human beings worst away. By the government told it was manufacturing improved to the framework as it was rolling of, but told versatile letter of credit would facilitate the framework and dressmaker supporting superior to assist those largest in requirement. Yet, NHS providers Vice Head Execution Crocus Cordery told her members were precise how public and economical pressures are transferring in high consumer demand for services. She told the feedback loop showed how growing consumer demand was challenging problems as services struggled in personnel shortages. The intended down there were inadequate services in the society and patients needy clinic-based thoroughness were at hazard of creature shipped off of their household areas. The psychological public health bosses stipulated feedback loop to their trading flesh NHS providers. The team requested bosses of psychological public health trusts to reply questions via and on the internet examination. A full of 35 bosses responded questions on economical and public factors of almost 60% of England's devoted psychological public health trusts. The benefits framework and the changes creature done were told to be growing consumer demand by 32 trusts. Meantime, 34 quoted finance odds, 33 homeless and 31 job insecurity as factors. Broad public issues, such as the absence of regional services and solitude were as well allocated by Lot Gender Farm, Head Execution of Psychological Public Health Mercy Reason, told, changes to the benefits framework in latter year, and strictness usually, include had a destructive effect on the lives of lot human beings in psychological public health problems. Will Hyam, Connect CEO of Campaigns and Social Sphere at Reconsider Psychological Disease, added, if we're to include a benefits framework how is fit for goal, it is urgent how personnel are educated man on which it tool to dwell in psychological disease and how they get the period to know and thoroughness on those who use it. Denise Martin, 49, of Bristol, is one man who says the economical environment has done her struggles in psychological disease more than hard, challenging her insomnia and concern. She has had psychological public health problems with she was 16 and has now been undiagnosed in bipolar disturbance and as well struggles in her portability since of dorsal problems and persistent ache. She has had expertise of using for benefits with 2011 while she had to offer up job as a psychological public health nursing. She now gets occupation supporting benefit and private autonomy payments for her natural problems. But she told she has found benefits personnel hard to transactions in and impassable to her state. I can't speak you how tense it is while you get a firmly formulated email in big letters proverb, if you do not get all the testimony in a monthly, your gain will halt, it throws all away kilter and gives you a sense of despair. I believe the entire trial is brutal. I sense impotent.